couple of days later, I had the opportunity to pick up that pencil and that pad of paper again when two ophthalmologists came into my room. They positioned themselves on both sides of my bed and they said, "Marcus, do you know that we did surgery on your eyes yesterday?" And I wrote out, "Yes, I know." They said, "Do you know why? To try to get me to see again?" They said, "Marcus, that's what we were trying to do. We had to go inside and look at the damage that was done to your eyes to know if we could save even a small portion of your sight. And unfortunately, Marcus, we quickly realized that we would not be able to save even a fraction of your vision." And I wasn't sure that the message was getting all the way through. And so I asked them what I thought, and I said, "Does this mean I'm blind?" And they said, "Yes, it does." And that's when my life changed. It's probably not going to come as a big surprise to you that I have spent a good portion of my life in counseling and therapy. In fact, as much as these last couple of years have been rough on us, I am so glad that we're at this point in time, because decades ago, the idea of therapy and counseling, it was stigmatized. People would say, "Oh, you know who goes to counseling? That's for crazy people." And I totally disagree with that. Counseling and therapy is for smart people. It's for smart people who have been hurt and who do not want that hurt to govern the rest of their life. And very early on in my counseling career, a therapist told me a little phrasing. It's kind of counseling 101, if you will. It's a little phrase some of you know that says, "Hurting people hurt people. Hurting people hurt people." And in that moment that these surgeons told me that I would never see again, I wanted to hurt them. Because in my screwed up way of thinking, I determined it's not the fault of the drunk driver who did this. It's not their fault. It's the incompetence of these surgeons. And so I wrote out every insult and every curse that I could to these doctors. And finally, I asked them things like, "How can you even call yourself a doctor?" And finally, I wrote as big and as dark as I could across that page, "I hate you." Do you think I really hate those surgeons? I don't. But I know that hurting people hurt people. And I ask you, healthcare friends, are the patients that you serve hurting? Of course they are. They're patients. Are the families of the patients that you serve also hurting? Of course they are. We are in such a difficult time when those family members can't be at the bedside. And that means another question. Are your coworkers and your colleagues hurting? Absolutely. Absolutely. When you have to hold up an iPad or an iPhone to let a patient talk with their family members outside the hospital because it's too dangerous for those family members to be inside the hospital, that's tough. That's painful. And I want you to know that if those families or if those patients act ugly, if they get uppity, if they lash out at you, whether physically or verbally, I hope you'll be able to remember that piece of advice that my first counselor gave me. Hurting people hurt people. Suffering is part of the human condition, and we, as those who are in healthcare, get to try to help ease that suffering.